Madam President, members of the board, thank you for this opportunity to share this information with you. With the district's intent to focus on a localized approach to addressing COVID-19 spread in the CUSD community, this presentation will review benchmarks and learning scenarios, review Maricopa County data, provide perspective of district zip code area data, review successful mitigation strategies, review our CUSD COVID-19 data, discuss in-person learning, and then provide a CUSD plan to determine when to move a site or sites to temporary virtual learning. What I'd like to do is first start by reviewing the benchmarks and the learning scenarios. We've had discussions previously, so just as a review, when we look at the community spread benchmarks, going from minimal risk to substantial risk, you will see that the focus in the benchmarks is cases, percent positivity, COVID-like illness. When you look at the minimal risk, it's below 10 cases per 100,000, below 5% for percent positivity, below 5% for COVID-like illness. When we look at moderate, it's 10 to 100 cases per 100,000, between 5 and 10% for positive, between 5 and 10% for COVID-like illness, and then for substantial, it's above 100 cases per 100,000. Percent positivity is above 10%, and COVID-like illness above 10%. So when we look at the definitions, just as a follow-up, our case rate, this is the number of people infected with COVID-19 per 100,000 people in a selected area. Percent positivity, this is the percentage of PCR diagnostic tests confirmed positive out of all tests performed in the selected area, being the PCR test is the, I believe it's the nose swab. COVID-like illness percentage of hospital visits. This information comes from the surveillance system that monitors the percent of people who visit emergency rooms and hospitals with symptoms of COVID-19. So what you see before you now is looking at the learning scenarios for the county benchmarks. You will see that this is the area or the document that was changed in the county that I think is important to note. You will see that in the red area, which is the substantial area, which is high, in order to move to virtual learning in the new documentation from the county, is all three benchmarks are in red before you move to virtual and on-site. This is different from what it was previous. And previous was the focus was moving from being in virtual, moving to in-person. And so to move to in-person, it was if you had one red in an area, you couldn't move up to the next. If you had one yellow in an area, you couldn't move up to the next, to the green. I think it's real important because the main focus at that time and all the documentation that had came out was how do you move from virtual to in-person? The new data, the new focus and the new directives, the new guidelines really focuses now on we are in the area of being in person. Now how do you move, if you move, to a virtual model or a hybrid model? So this was the area that was changed. You'll see you have a recommendation for resuming in-person learning. This is where we currently are. We're in in-person learning. This is what we've talked about many times as to what needs to occur if you're moving from virtual to in-person learning over a 2-week period is really what the focus is of when you're going to change from something. You're looking at something occurring over a 2-week period. So I'm not going to continue to cover this, but this is information that we've shared. I wanted to make sure that you had this so that you can refer back to it when you're looking at what does that mean for going to in-person learning. I think this slide here is the important piece when you look at what has changed. When you look at the recommendations for considering returning to virtual learning. This is new. This was not in the documentation in the initial plans because it hadn't come out from the county as to what it looks like when you're going from virtual or from in-person to virtual. We had started in virtual and then moved on. So important to look at in this slide is going into the bullets in this area. What you see is if school district or other defined school area has one or more benchmarks in the substantial category for 2 or more weeks, schools should consult with the Maricopa County Department of Public Health to determine whether to prepare to transition back to virtual learning with onset supports.
Dr. Gilbert, if I could tell the board and the community, this PowerPoint was inadvertently not posted. It is now posted. You might have to refresh your computer and it'll come up on your computer. I apologize to the community, but this will be available online now.
And if they are following along, we are currently on slide 8. Next, if a school district or other defined school area has all 3 benchmarks in the substantial category, public health recommends schools transition to virtual learning with on-site support services. So these are the 2 pieces I think are very important. Prior, again, moving from virtual to in-person. Now this focuses on moving from in-person to virtual. The change that has been the conversation is having to be in red for all 3 benchmarks before you go to virtual. One of the conversations that was at the last board meeting was, I believe by Mrs. Love, asked, what does that mean for us? And one of the things I shared was, we've had a plan in place and we would stay the course. And I think it's very important to clarify what that meant. We were already as a district looking at what is going to occur after having 2 weeks in a red category. And in that 3rd week, looking to see what was that measure? What was coming from the county as to what our district looked like? At that time, it was making sure that once we get that information, determining what our next steps were. It wasn't an automatic one way or the other, because everything that we've had from documentation wasn't what do you do and how you're going to move back. So as a district, we've been having conversations to say, with this happening, what is our next step? What does that look like? So I think it's important to note when we look at what has come out from the county and what we've been doing as a district. We've been monitoring our data for some time. With that being said, when we look at the Maricopa County data, a couple things I want to share, and this slide came from the COVID-19 Return to School Update, which was on November 12th, and it was hosted by the Maricopa County Public Health. You will see in this slide, the peak that you see is early on in June, July, to now early November. But what I really want to put have your eyes look to, and that is the graph to the bottom left, which really gets into focusing on, of the cases in Maricopa County, what are the age groups that are affected? And so when you look down, you'll see 0 to 19, 14%, 20 to 44 years of age, 49%, 45 to 64 years of age, 26%. When you look at the total number of cases that are in Maricopa County, other than those that are 65 and above, the next group that is affected the lowest, not meaning that they're not affected, but affected the lowest would be that group that is from age 0 to 19. In this next slide, also from county data, I wanted to be able to show you what we're seeing currently. You'll see to the left of this slide, this is June, July of where we were at our peak. And you'll see to the far right is November, and at this particular one, it's November 7th. I know there is a November 14th that is out there on the county website that still shows that trend going up. It's not going down, it's still going up, and we can see that through this. But I think what's important is to note is where we are, understanding that we have to watch our data, and the trend is moving in an upward direction. Now, I think it's important, again, in making sure that we're transparent so people can see exactly what are we looking at when we're looking at data for our district. I think this is an important slide because this really gives us the zip code and broad picture of our district. You'll see that there's red and yellow throughout this area. Is it all of our district? No, but there's some key areas here. We have to remember that we're a district of 80 square miles. With that being said, you'll see that we have red in some of our areas and we have yellow in some of our areas. From in this 85142 area of Castile to the 85225 to Chandler High to the 85248 of Hamilton High School. And I just use those as landmarks so you can see the spread that we have from our district. But I think it's important when we look at this information, it really is on the surface. So we need to be able to look and see the full picture. So I think it's important that we peel back this first layer of the zip codes within our district and break it down a little more. Understanding that within our district, we have a number of zip codes. So if we start with 85297, you can see that in this, you will see in the red, we have cases per 100,000 is red for 2 weeks, which is why of having a red in 2 weeks, you will see that they're substantial, and it's saying prepare for virtual. But you also see that there's still some yellow and green in this last week. Now this is starting with last week's data that was on the 12th. The next data that will be presented by the county will be tomorrow. So we'll see what that data looks like. But when you look at this chart, you'll see that cases per 100 is in red, and it's been red for the last 2 weeks. You'll also see that percent positivity has increased from 4.9 to 8.47, which is now in the yellow. I share that so you can see this in this particular zip code, you will see 2 reds. Because there are 2 reds in this zip code, that zip code is going to show as red. If we move to the next area, which is 85224, you will see that there is only 1 week, which was last week, in the red area, which is the case per 100,000. It wasn't in the previous week. You'll also see that the percent positivity did increase from 4.6 to 8.2. But because it has only been 1 week in this area, it's not red on our map. So understanding why is there a red or not a red also comes down to what are you seeing within that area for the percent positive or the 100 per 100,000. And you still see that there are some green as we look at the COVID-like illness. So then when we move to 85249, again, you still have 1 red. The possibility, depending on tomorrow's data, could be a second week of red, which then could make this area red. Currently, it is not. You'll see that there has been an increase in percent positivity from 3.4 to 6.8. So we'll see what tomorrow's data brings us. And then finally, you'll see that 85248, there's no red. So if there's red in their area of cases per 100,000, it will be their first week in red. And it wouldn't be to the following week if they're red again, that would become a red area. Real important because you can see that different parts of our district, depending on where the zip code is, depends on where you fall and what's happening in the community. But we can't just focus on what's happening in regards to that particular community, because we know within our district, at least 30% of the population open enrolls to another area that's not within their boundary. So it's not so simple that you can just focus on a zip code. So that's why I wanted to also show you this slide, which is the district over the last 5 weeks. You will see that you have red in the per 100,000, and that's been the last 2 weeks, which is why the district turned red. Now understand that the district data comes from the collective of all of the zip codes. But if you have anywhere in your district where you have a location that is moved from yellow to red because they've had 2 weeks of that data, it puts the district in red. So I think it's real important when you're looking at the district picture, you can't just figure that the whole district is sitting in the same spot, but the district is a collective. So you will see on October 15th, we had 2 greens and a yellow as it relates to where the district was. December 29th, we're still there. Some increase, but not much. We get to November 5th, and that's where you'll see our first measure in the district where there was red, and that was per 100,000, in regards to that red. And then we moved into last week, and you have per 100,000, which gave us 2 reds, but you still have 2 yellows in the percent positivity and 2 greens in COVID-like illness. So when you look at the data, you can see that it would make, you really need to look at all the data from a perspective if you were going to make any decisions. That's why in the start of this conversation, it was really looking at localized how you're going to address it, because not every area within our district looks the same. We understand that the trend is moving up, and we have to address that and make sure that we're following that information. But we have to understand that early on, when we had our presentation from our person from the county, the goal was we looked at where we are for 2 weeks. We would get into the third week and see what is that data telling us, and we would have conversations and have a plan, but we wouldn't have a knee-jerk reaction as to automatically making a particular decision. So when we look at where are we from a global perspective of our district and then narrowing it down into where we are as it relates to the zip codes or our school, I think that's where we need to really look at the data that we have. With that, I'm going to turn it over to Mr. Rother.
Thank you, Dr. Gilbert, members of the governing board, Dr. Castile. Before I jump into some slides about our individual sites and how COVID-19 has affected our schools, I just want to reiterate something that Dr. Gilbert spoke to, is that prior to opening schools for in-person, we had county data to go on. Now that we've opened schools and been open since September 14th, we now have some site data to look at, and we also know the mitigation strategies that we've put in place. So it's important as we look at our in-person learning that we take a look specifically at the school sites and that data, and also our mitigation strategies. So here's our current mitigation strategies. As you know, we've increased the frequency of disinfecting and sanitizing our hard surfaces at our schools. We have an increased focus on hand hygiene, and as you all know, we have sanitation stations in every room. Teachers have been great and principals have been great about reminding students to wash their hands when they come in from breaks and at numerous times during the day. Social distancing protocols are in place where possible. Cohorting, especially at the elementary schools, and limited social interaction in classrooms and common areas is taking place. Obviously, we have adequate ventilation and air filtration systems in our schools. We're currently contact tracing, so we are doing that through our health services department. And quarantining protocols are in place for students that come into close contact with students who are positive. And the final two I want to stress, because they truly are important to our mitigation strategies. The first is the parent support that we've gotten thus far about making sure that they check in with their students and keep sick students at home. That's the #1 way to prevent the spread of COVID-19 in our schools, is to ensure that if students are sick, that parents are keeping those students home and monitoring their symptoms and getting them tested if possible. And then finally, the mandatory face covering policy, which we've implemented since students have been back in person. There has been some new research on that. The CDC's updated its research regarding face masks. And I'm not going to read this whole thing to you, but I underlined what I think is probably the most important statement there is the prevention benefits of masking is derived from the combination of source control and personal protection for the mask wearer. So prior to this, it was unclear as whether or not masks helped stop the spread for both the person wearing it to spread those droplets, and also how well did it protect someone who's wearing a mask from inhaling those droplets. And so now the CDC is supporting mask wearing as a preventative measure for both someone who may be infected and from spreading, and also protecting a person who's healthy from transmitting the virus. So we know that masks work, and we're going to continue that policy. So now let's take a look at the CUSD schools and COVID by the numbers, and take a look at how COVID-19 is affecting our campuses. So what I have here is cumulative positive cases reported on CUSD campuses since we resumed in-person instruction on September 14th. The total number of staff is 46 out of approximately 5,000 staff, and that's a positivity rate of 0.01. Total students in person, and that's 178 of the approximate 38,000 students that are attending our schools in person. That's a positivity rate of 0.05. And then we've also added the total students in our Chandler Online Academy, and that's our 100% virtual option for students, and 28 out of the approximately 6,000 students attending Chandler Online Academy full-time, and that's a positivity rate of 0.05. What's interesting about this is that, as you can see, the positivity rate in the Chandler Online Academy, so these are students that have never stepped foot on our campus, they're at home learning virtually, is the same positivity rate as students that are attending in person. And so we know COVID is in our community, and we know it's in our school as well, and we're doing what we can to mitigate that. But it's interesting to see that the positivity rate is the same both for students attending virtually and in person. We're also reporting per schools how many positive cases have been reported. Again, cumulative. The number of schools reporting at least one positive case has been 35 of our schools. The number of schools without any positive cases reported has been 10 of our schools. And currently, the number of schools without an active positive case is 32. So 2 out of 3 of our schools currently do not have any positive cases reported on their campus. This is the updated dashboard. And as you know, this has gone through a little bit of a facelift within the last week or so. This is updated daily on our website. It has the total number of employees and students at each site, the confirmed active cases, the percentage of active cases, and then the total resolved cases. And so I've had some questions regarding, we've all had some questions regarding active cases and what that looks like and how a case would get to this dashboard. And an active case is a case in which we have documentation from the parent of a positive test or documentation from Maricopa County of a positive test. Once we get that documentation, then we initiate our contact tracing, and then that number gets posted on our dashboard. And so currently, if you were to check our dashboard as of right now, again, I reported what that positivity rate looks like at the schools. 5 of our schools are reporting 3 or more cases, and of those 5 schools, 4 out of the 5 are our secondary schools. We do have 1 elementary school that's reporting more than 3 cases. So overall, relatively, the active cases haven't reached that, aren't over that 3 number for the most part. Now let's take a look at our quarantine data. Obviously, as we have positive cases on our campus, that doesn't just affect the student that's positive, it affects those students for which they come into close contact with. So we wanted to provide some information again on the cumulative numbers of students that have been quarantined since we resumed in-person instruction on September 14th. We have 112 students at the elementary level, 303 at the junior high level, and 1,461 at the high school level, for a total of 1,876 students, and that's as of today, who we have needed to quarantine due to their close contact exposure with students that were positive. So I wanted to add on there as well that the total number of students testing positive while quarantined due to close contact with a positive student was 9. So one of the questions we know that you've gotten and we've gotten as well is how many students, when we've quarantined them, have actually ended up testing positive? And so we have had 9 students that have ended up testing positive while on quarantine. The total number of staff testing positive after their close contact with students on our campuses is 0. So we have not been notified of any of our staff that, due to close contact with a student on our campus, have tested positive. Now, I want to caveat this number to make sure that we're all aware that this is just data. And so obviously, when we've quarantined these students, it's not to say that some of these students may not have been asymptomatic. Some of these students may not have had mild symptoms that they didn't get tested. The other thing it shows as well is that the 9 students who ended up positive while on quarantine doesn't necessarily mean that they contracted that or transmitted that due to their close contact with a student on our campus. Obviously, this is data and a piece of data that we've been asked several questions about, so we thought it important that you had it. To summarize this, our early CUSD data does not indicate that COVID-19 is being transmitted on our campuses really at any substantial rate. So when we take a look at the overall district and school data picture, I think it's important to outline the following things. First, the district metrics that were in red, as shared by Dr. Gilbert, is not representative of the COVID-19 incidents on our campus. early school data suggests transmission rates in our schools do not mirror the transition rates in the community. Now, the next two bullets might be the driving force behind the first two. So staff and students have been following our mitigation strategies that appear to be preventing the spread of COVID-19 on our campuses. And obviously, as I shared before, masking up matters. The new CDC research confirms the importance of wearing a mask. So overall, when we take a look at Maricopa County and our district data, along with the specific school site data, it does suggest a more localized approach to school closures. And so with that, we'd like to share our plan for continued in-person instruction and then share the targeted temporary site closures if necessary. And I'm going to turn it back over to Dr. Gilbert.
Thank you. So Mr. Rother was able to share that data with you. It's important to know that there's a lot of information that we need to take into account when making these decisions. We look at the numbers of positive cases on campus, the number of students that were quarantined, but we also need to look at, in maintaining in-person learning, what we're seeing is the successful mitigation strategies occurring, whether it's face coverings, hand washing, cleaning that is happening in the classrooms, in the hallways. Quality of instruction is stronger with face-to-face opportunities for students. Average daily attendance and student engagement is higher in a face-to-face. Interventions and tutoring have greater impact when a teacher is able to work with that student directly and in person. Cohorting of student groups help maintain stability. Same classroom groups, for example, in elementary. Currently, percentage of school cases are lower than community percentages. Social emotional supports available for all students and staff at the site. Able to better meet the needs of special education students, as well as maintain employment for support staff such as food and nutrition workers, bus drivers, classrooms, paras. Eliminating in-person learning, more opportunity for community spread with more unstructured time. One thing we do know is when school starts to when school ends, they are at a location that is being mitigated. We're working as hard as we can to keep them as distant as possible, wearing masks and cleaning, where when they're not at school, where will they be? Hopefully at home, but possibly in the community, hanging out with other friends, doing other things. Technology or access divide across student and environments we know has been an issue in talking with parents. Instruction may have reduced student-teacher interaction. What can be done over technology becomes difficult for some students to connect. Average daily attendance is lower due to limited engagement. Also, finding kids that we're trying to connect with because of going to virtual, making sure that we are getting to everyone who needs to be at school, but at times having difficulty finding where they are. Less controlled mitigation strategies from a district level, as no consistent cohorts available, as I mentioned. Research shows online school is more difficult for students in grades K-3. Parents are not instructional specialists. We've had conversations. Limited on-demand feedback for assistance when parents are trying to help or siblings are trying to help their younger sibling and not having the ability. Excludes or limits students from social emotional supports. Isolation from peers at home, limited social interactions, limited access of social workers and counselors. I know that there was a presentation recently from the state superintendent, and she shared that there was in Arizona 31 suicides by students last year, and this year we're already up to 47. I think it's an important number to note. Virtual learning does not meet needs of some special education students, and the impact on parents' ability to be present at home when students are at home. So with that, I will then turn over to Mr. Narducci.
Thank you, Dr. Gilbert. Madam President, members of the board, based upon the localized data and actual impacts to our students, staff, and school communities, we're recommending the following plan to transition to temporary virtual scenario when a school or schools reach confirmed active positive COVID-19 cases among staff and students. Important to note that that number would be staff and student cases. Our plan includes a percentage of active COVID-19 cases to move a site to the temporary virtual model. The percentages we've come up with for elementary schools are 2% active cases at that particular site. For junior high schools, thank you, Craig. For junior high schools, 1.5%, and for high schools, 1%. Exceptions may be made for our alternative sites. As you know, our alternative sites are quite smaller. And so we would look at what those cases are there and make a decision that may reflect more of that 2% like the elementary is as well. It's important that the data is reviewed as a whole. And so a bird's eye view is very important, as we've seen in the presentations, both by Mr. Rother and Mr. Gilbert, Dr. Gilbert. But we have to view affirmative actions and actions that we take intentionally by looking at the localized data. So what might that look like? So for elementaries that are between 500 to 800 students, I'd like to bring us through a few scenarios. An elementary of 500 students and staff would require 10 active cases, confirmed cases, for that school to transition. An elementary of 800 students, which would be a school of our 31 elementary sites, would have 16 active cases. A junior high of 700 students would have 11 active cases at the 1.5%, and a junior high of 900 elementary students and staff would have 14 active cases. Our high schools would have a smaller high school of 2,500, would have 25 active cases between staff and students, and a larger high school of 4,000 students and staff, 40 active cases. You may ask why the percentages are different between elementary and high school. Well, at elementary, we do have the ability, with the lower numbers, to have additional mitigation strategies that the high schools may not be able to put in. And then also the sheer difference, and I think people can see the sheer difference of a percentage in numbers. Elementary schools are quite lower than our junior high schools, lower enrolled. And then, of course, staff is a higher percentage of allocated staff to at the high school level and the junior highs. So what's our temporary school closure timeline and process? When a school hits the threshold of student staff active cases, and believe me, we look at this multiple times during the day. Ms. Hartley is on the phone, and with Mr. Rother, Dr. Gilbert, and myself, it seems like we have one-to-one connections throughout the day. So we want to make sure that our families are notified 48 hours in advance of any temporary school closure or school closures. This provides proper time for parents to make adjustments for safe care of our children. We have to understand that we're still responsible for our children throughout this closure period, so we want to make sure that that transition is done successful for parents. Instructional model shifts to virtual learning. So when a school is closed and when they hit that threshold, we go to virtual learning. It's not a blended learning, it's a virtual learning. With our students, we've done that and we've modified at the beginning of this year to become a little more successful, and our teachers have put in so much time and effort into really working with that model. So we'd go back to what they know best and would move into the virtual. School sites would distribute the computers for students who do not have access. So it may be that they need the device, it may mean that they have to have connectivity. So we would ensure that distribution, rather than before when we went down as a whole district, we did centralized distribution. This would be at the site to be able to expedite the computers to students who need them for that time period. Staff and teachers would report to the campus 24 hours after school closure is called. What happens during that first 24 hours is really important. We would go through the school to disinfect and would have a district-wide fogging. Mr. Fletcher and his team actually are doing that now when we have cases. We'll go in and fog classrooms or hallways or wings or entire portions of campuses just as a preventative measure. This would include that happening during the first 24 hours. So after the first 24 hours, everybody would be out of the school, the disinfecting of surfaces and the fogging would take place. These are mitigation strategies that the county would work with us on to be able to move forward with. But that's why that 24 hours, the next 24 hours, teachers would come back in so they have all the resources available to them to continue that virtual learning within the classroom environment. When a school hits the threshold of student staff active COVID-19 cases, the school will be closed for 5 days. Now that 5-day closure may accompany a weekend, which will require a 7-day rest time for that school. If it hits the 5 days within a week, of course, we'd have a 9-day. But what we're sure of is that it would allow most positive cases that are triggered, the temporary closure, to clear before returning back to the impacted site. So it would give us the required time for everybody to come back in with a fresh start, and for that to dissipate through that area or that community. It allows for students with COVID-like symptoms to be evaluated during that time as well. And then it also allows the opportunity for students to be tested, or staff, for COVID-19 and obtain results. So that period of time does give us time to be able to do that. Our recommendations don't come lightly, but we also look at the fact that our localized data shows different things for different schools within our district, and this plan will provide us an opportunity to act intentional, to adhere the right amount of fix or the measure of being able to put some preventative and measures in place by the site, and enable for us to focus and concentrate on that site, and then bring them back together to continue the in-person learning and monitor the numbers from there. So we present the plan to you based on all the input and the data that we have and made available to you, and are welcome for suggestions on the plan as you see it moving forward.